Greta, you and your dad both got sick after traveling in Europe, I understand. I know you isolated yourself from your family. What was that like?
Well, I mean, first of all, we still haven't gotten tested because here you don't get tested unless you're in need of medical help. So of course I don't know if I've had it, but I isolated myself anyway, and because it is the right thing to do. We all need to take these precautionary actions and do our part in supporting society. And well, I'm the one who can least complain about this because I haven't. So I'm very grateful that I haven't been affected by this in a way that many people have. But yeah, it was just the obvious thing to do, the only right thing to do.
I'm curious, Greta, you've been in isolation then for some time, I guess, at your apartment there in Stockholm. What has life been like for you?
Well, I'm not completely isolated. I can still go outside and so on. And in Sweden, the situation is maybe a bit different from other countries, maybe in the US. But so yeah. But of course, I have been almost only in my apartment, which have been. Well, I can still do things from home, so I can't really complain. So I've been doing things that I before didn't have time to do. So I was very lucky.
You have millions of young people who follow you online, and I know you've been talking with them about taking this virus seriously. Your symptoms, whether you had COVID or not, the symptoms you had were very mild. You were saying milder than other times you've been sick. But one of the points you made, I was reading on your Instagram, is that kids should take it seriously because not only could there be underlying conditions, but also even if their symptoms are very mild, it's still possible to infect family members.
Yes, exactly, and that's why I decided to post about it, to sort of spread the information that many people don't even notice that they have symptoms, and then they might spread the virus without even knowing it. And there, especially we young people have a very big responsibility because we aren't usually the ones in the most risk. We might not experience the symptoms as bad as many others. So we have to be extra careful because our actions can be the difference between life and death for many others.
You were awarded a $100,000 grant from I believe it was a Danish foundation, and you were donating that $100,000 to UNICEF to help protect kids from the fallout of this pandemic. And I know you're raising even more money for UNICEF, and I know another organization has done a matching grant on your $100,000. How do you see that money, or how do you hope that money is going to be used?
Well, first of all, I did that, and we have launched a new campaign to help support UNICEF during the COVID-19 pandemic, and that is because during this crisis, during any crisis, it is always the most vulnerable people who are hit the hardest, and that is children, especially in the global south, in people in the poorest parts of the world, and especially people living in conflict zones and refugee camps.
Because there's so much focus on coronavirus, there's a lot of kids around the world who may die of things that are very treatable, but because medical systems are overwhelmed, it's going to impact children in ways that a lot of people don't really anticipate. Even all the schools shutting down, for many kids, that's their primary source of a nutritious meal.
Yeah, and sanitation, and I mean, we're talking about washing our hands and staying home, but I mean, for many people in the world, they do not have access to clean water or sanitation, to soap, right. And they do not even have a house to stay home in, and it's very hard for many to keep social distancing, and we have to that's why we need to help the people who are most vulnerable to this crisis in ways that we might not think about here in the global north, especially people in the global south.
And, you know, I have to say as well, I mean, Anderson and I have traveled around the world and seen the amazing work UNICEF has done in various places. I mean, it really is a terrific organization. Children's Emergency Fund, I mean, for situations like this. I do want to ask, you know, I mean, the thinking early on, as you know, Greta, was that this virus largely affected adults, but we are learning more and more about how this can affect children as well. I want you to listen to something Dr. Anthony Fauci said.
Children presenting with COVID-19 who actually have a very strange inflammatory syndrome, very similar to Kawasaki's syndrome. I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects.
So I don't know if you had heard that before, Greta, just this similarity to Kawasaki disease. But when you hear that, I mean, how does it make you feel? Does it make you feel like it's more frightening, that there's more of a mystery? What do you think?
Well, I mean, of course, that is very true. It's sort of a myth right now that children are not being affected by this virus, and that is, of course, very wrong. Children both do get this disease, and they also spread it onto others. So we need to be very careful that this misinformation that it doesn't affect children becomes mainstream. We need to make sure that people understand that this also affects children.
One of the things I've seen you talk about online, too, is just how important it is to listen to experts and listen to science. And this is a time when, you know, I was not a very good science student when I was in school. But this is a time, it seems, that, you know, the global scientific community is so critically important. And we're really seeing just how important it is to follow science.
Yes, exactly. And I hope that we can see now the scientific community are stepping up, and they are speaking up more than they've done before, because obviously this is a crisis that would require the scientific community to speak up. And I hope that people really, it feels like science is getting, the role of science is changing now. It's becoming more, people are starting to realize that we are actually depending on science, and that we need to listen to scientists and experts. And I really hope that that stays, and that also is for other crises, such as the climate crisis and the environmental crisis, that we actually understand that we have to listen to the scientists.